Kegels should not be the main focus of treatment during third trimester of pregnancy. In fact, we want to be doing the opposite. Let's talk about this. First off, if you're new here, I'm Dr. Brenda Heineke, and I'm a pelvic floor physical therapist, and I'm on a mission to change women's healthcare. So make sure that you like and subscribe to this channel so you can watch more videos just like this. All right, what are the goals of treatment during pregnancy? Let me explain. Each trimester has a lot of variations with what the patient can tolerate and what the goal of treatment should be. I'm going to start third trimester and work my way backwards. So for third trimester, our main goal is working on getting ready for delivery, especially if we're talking a vaginal delivery. So a C-section, it's a different topic for another day. We're just going to focus on vaginal deliveries. But what we want to do is prepare the body for that delivery. The main focus is getting the pelvic floor muscles to be able to relax and be able to fully lengthen. Why? A lot of people say that the pelvic floor muscles need to be strong in order to push the baby out. And so you need to do Kegels, which is a pelvic floor muscle contraction or strengthening exercise. Whatever you want to call it, they're all the same thing. They mean the same thing. That's not true though. The pelvic floor muscles are not pushing the baby out. The uterus is doing the bulk of the work. In fact, the pelvic floor muscles actually need to open up and get out of the way. So if you think back to your anatomy, the levator hiatus is where baby drops down through the pelvic floor muscles out of the pelvis. And the pelvic floor muscles stretch 2.5 times their original length during a vaginal delivery. That's a lot of stretching. So if the muscles can't stretch, they're not as elastic, not as pliable, it's going to make it a lot more difficult. So our main goal of treatment is helping the pelvic floor muscles be able to do that. How do you do that? We're working primarily on internal myofascial release of those deep pelvic floor muscles, not just focusing on the superficial layer with perineal massage, which is oftentimes what the research focuses on. So what we do here at our clinic is much different, and we've studied it with a research study to see on the effects on outcomes for mom and what that looks like for trauma on the pelvic floor and pushing time and C-sections. So another video for another day, but I really want to stress the importance of being able to have that pelvic floor stretch and relax, be able to lengthen. So we're doing a lot more manual. We're focusing on relaxation techniques, stretching techniques, everything that helps that pelvic floor be able to lengthen. Kegels is off the table. Now, I know there's always some situation that might warrant it, but in general, we don't want to be doing Kegels in third trimester. Working backwards over to second trimester and first trimester, it really is very dependent on what the patient is tolerating, if they're having any dysfunction, and what their goals are. This is where strengthening can be a really important part of pregnancy. I always say it's the perfect time to really work on getting the core engaged and activated. Maybe they are having some pelvic floor issues, and maybe strengthening is warranted in those stages, especially if they're having leaking or prolapse symptoms, anything like that. It's going to depend on what's happening with your patient, and this is where it's very patient dependent. But keep in mind that during first trimester, they can pretty much tolerate any position, really any exercise. As time progresses, you will probably need to start modifying what those core exercises are looking like. They most likely aren't going to tolerate positions in supine, so you might have to start moving them into other positions like quadruped or standing to get at those muscles. It also gets more difficult to activate as pregnancy continues. So every trimester, there are so many changes happening. Your goals also need to change with it, and your exercises and treatment also need to change. It's not a one-size-fits-all approach. And it is all very much on what is the ultimate end goal, and that's to help our patients have the best pregnancy and help them have the best delivery that they possibly can and minimize trauma so they have a good postpartum recovery. If you want more information on what we do to help our clients, then make sure you comment below and we can have a great discussion and talk a lot more about treatment options. So, see you on another video.